The Genomic Medicine Institute was formed to help our doctors better prepare for this big change in medicine that the personalized medicine revolution, if you will, is ushering in. With all of this technology has come incredible advances in the science of what the genome can tell us. It can tell us about predisposition to disease. It can tell us how we metabolize drugs, what kinds of treatments we might respond to, when a drug might give us an adverse reaction. This information crosses all specialties. It has had its biggest impact in oncology to start with, but it's having huge impacts in cardiology, clearly in obstetrics and gynecology. It's always been obviously around for pediatric diseases, but gastroenterology, rheumatology, immunology, all of these fields are being greatly impacted by this new science.
Personalized medicine, as far as it relates to cardiology, is most important in genetic diseases, and an example would be a long QT syndrome or hypertrophic cardiomyopathy. It would also be important in certain medications, in looking at how certain patients metabolize a medicine based on their genetic makeup. One of the advantages of GMI is that they offer genetic counseling for patients who have questions about their genetic markers. And this is a very good service that is free to patients who have physicians in the El Camino community.
That's what genomic medicine speaks to. It really says that each one of us is unique. We have our own unique genomes. They're not perfect. Sometimes we have mutations, and those are the kinds of things that may predispose us to a disease or may mean that we don't metabolize a particular drug. Our doctors want to know that. They want to keep up with the science. They obviously go every year to their scientific conferences and they read journals and learn about these things, but they're also very busy practitioners, and we're trying to make this information accessible and convenient to them, on the campus of El Camino Hospital where they work and where they practice. The important thing for patients to do is to really assemble their family history. And I'm going to tell you a brief story. We have been proactively contacted by the Grandmothers Club of Sunnyvale. They believe that this is an important legacy for them to leave their children because they know what their grandparents died of, but when they go, that information will be lost forever. So it's important for you to document your family history and to share that information with your physician the next time you visit them, and to pay close attention to the patterns and perhaps pursue some of those prevention measures that your doctor's been encouraging you to do for some time, such as regular mammograms, regular colonoscopies, eating better, exercising more. All of those things are going to help you, but knowing your family history does seem to help make those issues more urgent. The Family Medical History Tool will be available through the El Camino website. On the website, there's a big button right on the homepage for genomic medicine that will take you to our homepage for genomics, and the Family History Tool will have a link right there.
I think what we're all looking at and probably waiting for in the future, which will probably occur in the relatively near future, is that the entire genome of most individuals will be sequenced. And then we can all use that information to decide what medication or what doses of medications will be most effective for that particular patient. And things are growing by leaps and bounds in this field. And that's one of the very exciting things about this whole area of genomic medicine.